You're listening to the Fix My Feet podcast. Solutions for every step in your journey with the nation's leading foot and ankle specialists.
Hello, everybody. It's Dr. David Waters back with the Fix My Feet podcast, here with my right-hand woman and colleague and my PA, Ashley Anderson. So glad to be here. How you doing, Ashley?
Doing great.
Good. For all of those that love Dr. Leonard, we'll just have to excuse him today, and it's just the two of us to talk about some very interesting topics. But the first thing we're going to talk about is Ashley. So it's exciting.
Yeah.
For those of you that don't know, Ashley joined me, coming up on 2 years ago now, about, I guess a year and a half or so now, but in a few months it'll be 2 years, and it's been awesome. I don't think the general public necessarily understands what a physician assistant is or physician associate is. They've changed some of the nomenclature. Maybe you can try to break it down for our listeners, what the difference is, what are some of the similarities between doctors and surgeons and physician's assistants.
Yeah. So as a PA, and if you just don't know what to call us, it's always good to just say PA, and then you don't have to worry about it. So we go to school. So I have a bachelor's degree, just like a doctor does. But instead of going to medical school, I chose to go to PA school specifically, which means that I went to a medically based training, still in medicine, but I have my master's degree instead of my doctorate's degree. So I was in school for 3 years. Some PA programs are 2 years. It kind of varies in between the 2 to 3 year time frame. So I, as a PA, can do many things that a doctor or a physician or surgeon can, except for not the surgeon side. I cannot perform surgeries or do anything that would require more advanced training in that regard. I am a first assist in surgery, so I still do like close stitch, like different things. And whoever is, when you're a PA, you have someone who is called your supervising physician, or someone, they're trying to change that wording a little bit. So it's more of who's your collaborating physician. So who are you working with? If you have questions, since I did not go to medical school and I didn't have a residency, I don't have as much schooling as a doctor or any other surgeon. So when we are like in clinic, I could still see patients. I can bill for my own visits. I can do a lot of things. I can give injections, do procedures like ingrown toenail procedures, different things like that. Pretty much anything in the office we should be able to handle. And then if I had any questions, if someone had a foot deformity that I had never seen, but I know Dr. Waters has had years of experience in that, that would be something where I would ask him about the x-rays, or I would call him and ask him about that. And then he would be able to give his opinion and input of what I should do for the next visit. So it's working as a team to find your strong suits. And I definitely just haven't had as much schooling. So a lot of PAs do a lot of on the job training. So especially in specialties, that is, super important. So in PA school, I didn't learn a ton specifically about foot and ankles. So a lot of what I do and what I learned while I was on the job and training with Dr. Waters. Yeah,
well said. So let me just hit some rapid fire questions that patients might ask. Can a PA see patients by themselves with a collaborating physician?
Yes.
Can the PA perform procedures in the office with the collaborating physician?
Yes.
Good. So I think that's something we commonly run into. Like they think that they need to, like, if you see them, that I have no idea about what's going on with the care of the patient. And I think some patients feel that way, not just with our specialty, but at least in a surgical specialty, I feel like PAs and surgeons work very closely together. Would you agree with that?
Oh yeah, for sure. It's not my patient or Dr. Waters' patient. It's our patients. Right. So a lot of people, even if I have never seen them in a visit, I probably have answered questions for them on the back end, or I've sent them medications, or I have to know about their case to be able to do that. So we work very closely hand in hand in almost all patients, I would say.
Yeah. So, and I think that that's what's key to know. Like we move patients back and forth between each other for visits, but we discuss all the patients together. And I think that's true of most PAs with their collaborating physicians. That's true of the relationship. So I think that PAs have a great role in healthcare, that they can expand the coverage of the collaborating physicians. Because if you come into our office and you don't need a surgical consultation, you're much better served by seeing Ashley and having her work you up and get all the information. That way, when you get in front of the surgeons, they have all the information to make decisions. Otherwise, it's going to involve multiple visits at that point with the surgeon, and more cost to the patients at that point. What do you think about that, Ashley?
Yeah, it's true. I think that sometimes, I don't know, a different insurance, even a PA might be a little bit less of a copay. That's not true for lots of insurance. So that cost isn't always the same. But yeah, in general, I would say if I am treating someone conservatively and they said, I'm just ready for surgery, then that's in my note. And so all then the surgeon has to do is, okay, they're ready for surgery, and it's nice and straightforward.
Yeah. Why PA school, Ashley, when you're considering all these things you can do with your life and career? Why PA school versus maybe some other medical things you could have done?
Yeah, so I was on the medicine track to go to medical school for a long time, probably since I was, I think, a junior in high school until I was about a junior in college. So for about 4 years, I was on the medicine track. I had taken all of the classes I needed. It's not like I was failing out of anything. I still was doing great, but it's just the choice of lifestyle, and everything was a huge thing for me. So I haven't had any children yet, but I really would like to have children. And I just got married in November. So that's definitely coming up on my horizons. And that is something that's really important to me. And I just talked to quite a few female physicians in different specialties. I know that if I would have gone to medical school, I most likely would not have gone into like something that was probably either family practice or something more general. I just have always liked specialties. And so when you're a specialist, you don't have as much time to be able to have as much of a work-life balance as a physician or a surgeon and stuff like that. And many of the people that I've talked to or seen. And so it was a huge thing for me to be able to still have a balance. Like I could still go to practices and things and be able to leave work and not be the only one in charge of, or the main person, the head in charge of all of the patients. So that was one side of it. I also really like how a PA works in a practice. So it's a lot of, you're working with not only the patient, working on education side a little bit closer, but then also you get to work with physicians and kind of be a middleman in some ways. And I think that meshes pretty well with my personality. I am not always the best at making like super fast, hard decisions. A lot of times, like I'd rather work through the problem with other people who are making the decisions and make the most of it or give my input as needed. But that was just something that I found matched my personality the best, and I'd still have a good life and career. And it was number 1 or 2 in the like USA's best professions, and so it's like, oh, well, that sounds good too. So
yeah, it's definitely needed. And you are excellent at all those things that you just brought up. So
well, thank you.
Good thing. So, so you went to PA school, maybe a couple highlights for people, things that you really enjoyed about PA school, or things that, maybe really like sunk into you while you're in P school, like, yeah, this is a really good thing for me?
So I went to a smaller school, so I had a really good relationship with a lot of my professors and teachers who were also PAs, and all of their stories, like even their bad stories and how the profession has changed for the better. It just seemed like how much of a need in healthcare it is for people to take care of people and give people good care. Yeah. And so I think even in my first year, when we don't have a lot of clinical knowledge or anything yet, it was just really finding out like, yeah, this is good. And I had a really good group of friends, and just my whole class, I think everybody worked really well together to try to lift each other up and try to become the best practitioners that we can be. So that was really awesome. I think through school, obviously it was really hard. They always say it's like you're drinking out of a fire hose
Yes.
because you're learning so much at once. And when I would go, my first 2 years were all like in classroom learning. Then my third year was all rotations. And so I would go to a different specialty every single month, and in a different city or state is where I would do. So I had some really, really small towns that I had rotations in, some really large towns. And that was really important. I mean, really all the clinical knowledge, you need it so that when you go on rotations, you're not just completely out of it. But I had a couple rotations even with like M3s, which are medical students in their third year. And so that was pretty similar to me. I was in my third year of PA school, and I think it hit me sometimes when we'd be talking about different conditions. Like maybe they knew like a few of the weirder things that I didn't know, but I knew just as much as third year medical student a lot of times. And it was just really empowering to know that it's okay. Even though I chose this profession, I know things too. So even though I'm not going to be a full doctor and everything. So that was great. And I think that on rotations, I really liked all of them. Honestly, there were only a few I didn't like, which I knew I wasn't going to like. More of the ones where all I did was just sit down and talk about one thing every single time. And so I liked the variability in a lot of them. And so I knew surgery, when I was in surgery, I really liked that. So that kind of led me down to this path of where I found this job. But yeah, I liked the specialties, almost all of them. I think it was really hard for me to choose one when I was getting out of school.
So let's talk about that, because it's a little bit different. When doctors leave residency, they're pretty specialized at that point. When they leave residency or fellowship, their path is fairly determined at that point. They're going to practice a certain kind of medicine at that point, and they're locked in. When a PA comes out of school, they can do almost anything. Like they can emergency medicine, internal medicine, hospitalist. They can join a surgical specialty. They can, do any number of things at that point. So give us some insight when you're coming out. What attracted you to foot and ankle surgery? I know you just talked about you like the OR, but what were some of the things that attracted you this way? How did you make that kind of a decision?
Well, overall, I think it's just overwhelming to find a job when you don't have one specialty that you're trying to look towards. So I was mostly applying to jobs that had the surgical component as much as possible. I didn't really apply to like ER or family practice or some of those that I knew I really didn't want unless I absolutely needed to get them to get a job, because there's also a little bit of a fire under your butt that you have to get a job because you got to get paid and you got to pay off your student loans. So I think about half of my class had jobs coming out of school, and then about half of us didn't. And so when I was looking, I came upon this job, and I had been kind of towed around, honestly, by a few other jobs of like, maybe they were interested, maybe not. And so had a couple of good conversations with Dr. Waters. And so then I was like, all right. And when I came and shadowed in the practice, one of my fears of any PA, I think, coming out of school is you don't, number one, want to be in a position where you're going to be misused as a PA, because it's hard if you're working with someone who is a supervising physician who is going to want you to do things that aren't legal or whatever. And it's hard to find that balance with someone who is your superior. And so that was one of my fears, but then also that whatever I was going to do was going to be boring because it was too routine. And so I shadowed here, like foot and ankle. I'd never heard of foot and ankle specialty before, honestly, before I applied for the job. It's not something you really hear about in PA school because it's just, you hear about ortho and that's it. So that was one of my things about ortho. I always liked orthopedics, but then on my orthopedic rotation, it was kind of routine, knees and then shoulders. And that was pretty much most of what we saw. But I came and shadowed in the clinic, and every single patient, I would say was very, very different from each other, from just a callus to a surgical consult that was all about soft tissue or ligament repair, and then a surgical consult about a total ankle, or this is a person with end stage arthritis and they didn't want to have surgery or they weren't a good surgical candidate. So how do we deal with that? And so every single person I think was so different. That's really was interesting to me, and it was helpful. I think you can't have an aversion to feet or the smell of feet, and I've never have, and it's just great that I knew I'd be able to do so many different procedures every day, so something to work with my hands more, and I really liked that as well.
Good. No, I think that's great. And we've enjoyed having you, and you've been such like I said, a big, huge blessing to our patients. And I think that that's what a good physician assistant can do for those wondering, patients wondering, people listening, what they can do. They can really extend and increase the quality of care that can be provided by the practice. And Ashley's definitely done that in our practice. So I think a question that probably a lot of patients have is, what is your role when we go to the operating room? Like, are you the one doing the surgery? Is Dr. Waters the one doing the surgery? Like, who's cutting on what, So how would you say, what's your role when we're in the operating room?
So I'd say one of my main roles is I'm the first assist. So we'll get to that in a second. But when you get into the operating room, you always have to kind of be positioned in a specific place. You have to make sure the foot and your hip, everything is positioned. So I'm in charge of making sure you're in the optimal place. Everything is comfortable, at least that like when you wake up, something's not going to feel out of whack or something like that, you're positioned correctly for the optimal surgery. So that's usually part of my job. And then as we're coming into it, a lot of the time is if I wasn't there to be a first assistant, if Dr. Waters needed someone to like hold retractors, which are just pieces of metal pretty much that you're holding open the skin or whatever layer of tissue so that you can have good visualization during surgery. So I would say that one of my really important jobs during surgery is to make sure that the surgeons can see. So I'm doing a lot of making sure there's no blood in the field or bone, or keeping the tissues and protected. So all your nerves that we don't want to cut are out of the way. And then if there are things coming up that I know, at this point we're going to drill. So I can say, hey, we're going to need this next. And I can try to cue. So that way, if the surgeon is thinking through making any cuts or what he's going to do next, that I can try to cue the person who's running the back table with all the instruments. Or if someone who's new and they're maybe not as comfortable with working with us, that I'm also, I feel like, more beneficial in those moments. So then after all of that work is usually done, I will usually close up the skin. So we always clean everything out and wash it out, flush it out with some saline. And then I will close up all the skin incisions and then put you in the dressing and make sure that everything is good coming out of the OR as well. So I kind of start the case and then end the case. So that way Dr. Waters can go work on some documentation or whichever surgeon I'm working with.
Yeah, beautifully said. I also want people to know, the physician's assistants, they definitely help perform parts of the case. Like if there's, two things that need to be done, but I'm the one, or whoever the attending surgeon is, the one supervising all that. Everything's done right under the direct visualization of the attending surgeon. So they're a huge benefit. They make cases go way better, way safer for patients to have an extra set of hands and get everything done correctly. So that's kind of physician's assistant's job. So let's talk a little bit about Ashley, because she's just pretty exciting as a person. So I think that she's even better as a person. She's a dang good physician assistant. So she just got married to Doug. I don't know if we should say Doug's name, but she got married to Doug. So I already said it. So
yep, Doug's my husband.
Yeah. So
we just got married in November.
Yeah. Awesome.
But we'd been dating for 5.5 years. So, and we were friends before that. So we knew each other a long time. So
yeah, you went the opposite route of me and my wife, Valerie. So we went the much quicker route for marriage there. So,
that's true.
Yeah. So just got married, and we hope to have some little Ashley and Doug's running around Platte River Foot and Ankle Surgeons here sometime.
Yeah, you and my mom.
Yeah, I'm sure. She's probably way more excited than I am, to be honest with you. So, what other things can you tell everybody? Things that you enjoy maybe outside of what we do here on a day-to-day basis?
I would say that in the last year or so, year and a half, ever since I started this job, I don't necessarily have too many hobbies, but I'm working on developing hobbies again. So I love plants and I love being able to be outside in a garden. My mom had a huge just landscaping and just tons of stuff outside. So I love being outside and working with plants. And so our goal this year, Doug and I, is to have a vegetable garden and then we just bought a house as well. So all we have are rocks. That's our landscaping is rocks. And I can't wait to just dig the rocks out and get some plants. I love flowers. I was doing very good at one point about going to yoga. I really like doing yoga, but I have not been good about that. So I'm trying to get back into some of the things that I used to love now that Doug and I lived apart for about the last year until we were married. And so it was a lot of traveling back and forth and just figuring things out. So it was a little bit of a chaotic time in life. So I didn't do a lot of other random things I like, but I have more free time now that I have more stability at home. Yeah. So I'm excited to get into some of those things. I love drinking coffee and sleeping too. And I have a cat named Pinto, and she only likes to cuddle with me. So I cuddle with her on the weekends.
Awesome. Just on our way out, in the year and a half or so you've been with us, your favorite thing about foot and ankle specialty for our listeners?
I think that I just love that there's the variability of it. I really like that. I like that I can get to become really good in one specific aspect of the body that's so important. And it's not just one joint or something. There's 26 bones. And so there's a lot of joints and just things that can go wrong. So I think that that's just constantly learning, and the variability I really like.
Wonderful. Well, awesome. Now you've met Ashley. In coming episodes, we'll meet Dr. Leonard more in detail. And then we will shortly have the fourth member of our team joining us. Her name's Alicia. She's another physician's assistant. So I'm sure down the road, she's got a lot of training ahead of her, but down the road, she will be here and we'll make sure everybody gets a chance to meet her as well. So check us out on social media and look forward to our upcoming episodes. We are at Platte River Foot and Ankle on Instagram and Platte River Foot and Ankle Surgeons on Facebook and TikTok. We also have Facebook page specific for the podcast Fix by Feet Podcast. We are the Foot Fixers. Thank you for tuning in, and we'll see you next week.
Thanks.
Thanks for listening to another episode of the Fix My Feet podcast. To schedule an appointment with one of our providers, visit www.prfootandankle.com.